With the Delta variant spreading, some doctors are seeing children with more severe COVID-19 symptoms. In Louisiana alone, 2,000 children have been diagnosed with COVID this week. Dr. Mark Klein, physician-in-chief at Children's Hospital New Orleans, joins me live now. Thank you for being here. Louisiana is so close to Houston. We know we have a lot of viewers with friends and family in that state. We understand, doctor, that kids in Louisiana make up about 20% of new COVID cases, and very sadly, some are in the ICU unit. What is the status right now at your hospital?
Well, we've been inundated with new cases over the past several weeks. We went from having virtually no patients with COVID in the hospital to having as many as 20 on any given day. Today, we have 14 children in our hospital, Children's Hospital New Orleans, who are admitted for COVID, 4 in the intensive care unit. Half of these children are under the age of 12 years, and 4 are actually under the age of 2 years. So we're seeing children across the entire age range. This is unlike anything we've seen over the course of this pandemic. Last year, many people thought children were going to be spared, but that clearly is not the case. This new Delta variant has been a game changer, and it's inundating our hospital and hospitals across the state.
Yeah, I think a lot of parents, they were looking at the impact on kids last year, and with the original variant, and the chances of severe infection just seemed extremely low. So does the Delta really differ in that respect, in that it is affecting kids more severely?
Well, we think so. It's difficult to tell. We know that it is far more contagious than the other forms of the virus that we've dealt with. So the community transmission that's going on right now is just rampant. To give you kind of some numbers around that, a month ago, only about 1% of the children that we tested in our outpatient clinics for COVID was positive. 2 weeks ago, 7% were positive, and today about 15% were positive. So that tells you something about how much transmission is going on. So the kids that are hospitalized are really the tip of the iceberg, but certainly the children we have in the hospital are far more ill than any children we saw in the hospital last year.
And are these children that you have right now, are they considered to be healthy children, or do they have underlying conditions?
Many of them are healthy. Half of the children that we have in the hospital today had no underlying condition. They were perfectly healthy children until they fell ill with COVID. And the others who have underlying conditions have, subtle underlying conditions. They may have asthma, or they may have problems with obesity. But by and large, these are relatively healthy children or completely healthy children who have fallen ill.
And where are you finding that most of the kids are getting the virus from? Is it from unvaccinated adults or vaccinated parents?
It's from unvaccinated adults. This is a pandemic at this point of the unvaccinated. And so the principal things that we can do to protect children against this Delta variant are, number one, the tried and true methods of washing your hands really well, social distancing, and masks are so important, including in the schools. With kids going back to school, we strongly believe that children, teachers, and staff should be wearing masks. Our governor here in Louisiana actually has mandated masks in the schools and for children as young as 5 years of age. But beyond that, having all of the adults that surround these children vaccinated would be a huge step in the right direction. If children are surrounded by vaccinated adults, they're very unlikely to acquire the infection.
Okay, well, doctor, thank you so much for joining us from New Orleans this morning. And we know that you really need a win here soon at your hospital and in your state. So we're rooting for you as your neighbors next door. Thank you for letting us know about the situation there.
Thank you so much.
Take care.
Take care.